no news is not always good news. You have to be a advocate of your own health. You have to ask questions. You need to be educated on your disease states and take care of yourself. One of the things is you have to be your first line of defense and your own advocate. And make sure that if you're having testing done, that you follow up on the results.
Welcome, listeners. Today, Anita is joining us. She's a colleague of ours in the medical management department with 35 years of nursing experience. Anita started as a medical assistant at a local hospital, floating to all the different units. Getting a broad view of operations, she was able to see various nursing roles in the hospital to gain the experience and knowledge to move up. Once she started nursing school and was eligible to sit for the LPN exam, she did, and she passed. She worked on a skilled nursing floor as a charge nurse. After completing her education and passing the nursing boards, she worked on a surgical medical floor where she remained for nearly 30 years. Anita wanted to be a nurse for as long as she can remember. She fondly recalls watching the show Emergency and wanting to be just like Dixie McCall. I have a question about that later. She loves meeting new people, being able to help, and making a difference in the lives of her patients and Nova's members. She recently shared with us, and I quote, "Being a nurse allows you the diversity and opportunity to do so many things. You can work in a hospital, in a clinic, at an insurance company, home care, as a case manager. The list is endless." Currently, Anita works for Nova as a case manager. In this role, she's able to build relationships with members and help assist them with care coordination, resources, education, and guidance to help them work through their gaps in care. She assists them with any immediate needs to help them feel empowered to take an active role in their own health and wellness.
Welcome to the podcast, Anita.
Yay.
Thank you.
Thank you for joining us. You joined us for a webinar a few months back, so we knew you would be a great guest to join us for one of our very first few episodes. So thank you, thank you, thank you.
Yeah, thanks.
We're glad to have you here. And before every episode, we've been sending guests 3 questions so they can choose where they'd like this conversation to go. What is something you've learned that has been so helpful you tell everyone about it? What have you learned because something went so badly you want to warn others? Or given what you do, what do your friends and family always come to you about for advice? So you chose what is something you've learned that's been so helpful you tell everyone about it. So tell us what that is.
And this probably could have fallen into any one of the 3 questions.
Good.
I do have a broad experience in my healthcare career here. And one of the things that I heard very often early in my career, and probably even in the past 5 years, was, we'll call you if something's abnormal. Or if you don't get a phone call from us, don't worry about it. Everything's okay. That's all. No news is not always good news, I've found. And that's probably one of the things that I've really let my members and my patients know. I saw nursing start from documentation on index cards to charts, paper charts, and then it merged into electronic medical records. So talk about a lot of history. Things
I
get
feel
lost.
that way at the library.
Exactly. Right? The little index boxes you'd pull out, even the library card. Yeah. Things would get lost, paper charts. You actually had to have people taking every single document that came in and put them in charts. Oh, I remember stacks and stacks because I also have clinic experience. But those stacks of mail coming in and having to be put in the charts. And I would often hear people that I worked with, my coworkers, say, "Oh, get that test done. If you don't hear from us, everything will be fine. Everything's fine." And I'm like, no, call us. I want to make sure that little piece of paper hasn't gotten lost. So no news is not always good news. You have to be a advocate of your own health. You have to ask questions. You need to be educated on your disease states and take care of yourself. one of the things is you have to be your first line of defense and your own advocate. And make sure that if you're having testing done, that you follow up on the results. If your gut's telling you something's not right, I know something's wrong with me, you have to ask and you have to be educated. I do have a personal experience with a very close family member who noticed a spot on their arm and, wasn't concerned, but me as a nurse, you get this gut feeling. And I'm sure even, non-medical people get that gut feeling. Something's not right. I know my body. And I hear that all the time. I know my body. And that's great. But this spot that they had went from a little tiny freckle to, it almost looked like the size of an eraser head. And, they asked, what should I do? I said, go to the doctor, have them look at it. It's, maybe it's nothing. It's a freckle. You got a lot. Went to the doctor. The doctor said it's nothing. Everything's fine. And we watched it for a little while. And I'm like, no, you got to do something with that. Well, every single dermatologist they called, they couldn't get in. You don't have a diagnosis.
That's so hard to get into a dermatologist.
Right?
So hard.
Yeah. And you don't have the diagnosis, that big C word. You don't have it. So, no, we can't see you. Well, how do you get that diagnosis if nobody wants to do anything because they don't think it's anything? Well, my persistence said, nope, we got to do something about this. And I kind of became the voice of reason with this family member. And I'm like, nope, we got to see a different doctor then. Let's go to a different doctor. So we changed primary care physicians. And I went with him and I said, the doctor looked at it and said, it's just a freckle. I go, no, it's not just a freckle. Take it off. Biopsy, cut it out, do something. And then he's like, well, maybe I'll biopsy it. And the more I looked at it, I was like, no, take it out. Just take it off of them. So they did. And about a week and a half later, we had gotten a phone call. And it wasn't the phone call we wanted, but the doctor had called and said, we got a phone call from the pathologist and wanted to know a little bit more history about this. And the doctor told him, said, you saved his life by taking this off. He had melanoma. So when your gut tells you something's wrong, there's probably something wrong until you have had that conversation with the doctor and, had it all checked out to make sure that it is nothing. It's really nothing. But, it was part of that whole step-by-step process you have to go through. And, it was an awful diagnosis that, because it was caught early, is a good diagnosis right now, cancer-free.
Wow.
And you make a good point about, changing PCPs, because I think a lot of people, when you're dealing with that kind of stress and nobody's listening to you and you feel like you're screaming into a vacuum, when do you make that call? Because if you, like you said, your body, I think so many people, they avoid the doctor because they're afraid of that situation happening. And that frustration, is not, it's that added stress that they're like, oh, screw it, I don't want to go. To your point, when something's wrong and you're not getting the answers that you want, you guys change doctors and look what happened. I mean, it was a great point to make.
Yeah. And, it's relationship building, right? You have to have a good working relationship with your provider or your specialist. And if you don't, and, you're verbalizing that, and believe me, there's oftentimes in my conversations with members, I hear them, say, well, my doctor doesn't listen to me. And, then it's that conversation of, well, you have to have a relationship, right? If you don't feel that you have a good working relationship with your provider, there are other providers available that you could see. And, maybe you have to go through a couple before you find somebody that has the same viewpoint that you have, or, you feel that you can work well with them. And there's nothing wrong with that,
Right. It makes a world of difference. I had a PCP because my plan required that I have a PCP listed. And so I had one, but every time I went, that was never the person that I could get an appointment with. I mean, I saw that person probably once over a 6-year period. And then from there, it was always other people in the practice. And maybe that works for some patients and it works fine for them, but it was not my favorite thing. And I changed PCPs. Actually, I hadn't been there in so long. When I went to make an appointment, they said, we have to treat you as a new patient again because you haven't had a physical in, X number of years or whatever it is. And so you'll be considered a new patient. New patient appointments are booking like X number of weeks out. And I was like, well, all right, this is the sign to go find a new doctor. And so I did some searching around, found a new PCP to go see in February of 2020. I was like, this will be the year. 2020 is going to be the year I get a PCP that I get a good relationship with. I feel good about this. I'm going to, start to do all that regular maintenance stuff. And my appointment was for June of 2020 because that from February was the first new patient appointment I could get with this woman. And then it was June and I was like, this seems like a bad time not to have a PCP, so I should probably go. I masked up like I was going to perform the surgery myself. I was so scared. And I was like, I don't know if I'm going to go and get COVID or if I'm going to learn how to protect myself from COVID, but I feel like this is a good time to go. And you are so right, Anita. Like when you find that right person, like I sat down and talked to her and she was the first person that didn't make a comment about my weight, that didn't make a comment about, just things that I've heard over and over again. And really said, are you taking vitamin B12? Maybe it's something, she wasn't talking about prescriptions. She wasn't talking about, it was a whole different viewpoint of a PCP for me to be like you're saying, Anita, finding the person that's a right fit for you to actually motivate you or be invested in your care. And this year when I went, she said to me, you're doing good. And I said, I think I'd like to lose a little weight. I say this every year. And she goes, you know what? Do your best. Make yourself proud. And I'll talk to you in a year. And I was like,
supportive.
She was supportive.
Can I just say, I feel like we're talking about like we should have speed dating PCP events, like speed dating, like find your perfect
that.
PCP. Wouldn't that be great? Or you just like they don't have, enough free time.
Right.
But it would be great to have like speed dating because that's what it sounds like. I found my perfect fit.
Yeah.
She's my daughter now. Yeah.
And she's a good fit for me. And Anita, I love that you said like, it's okay to find a different doctor. And when you find the right one that will listen to you, even like you were saying, don't biopsy it, take it out. Take it out. I want it gone. Yeah. You need to have somebody that's willing to listen to, you. My husband and I were just talking last night that when my daughter was little, he wanted a blood panel on her because she was running a low-grade fever for a long time. And it was just bizarre. And he said, I remember the doctor saying at the time, like, why do you want a full blood panel? He didn't want to do it. And my husband said, I just want to see, like, something's going on. Something's not right. And he said, right. I'll tell you why I don't want you to get a full blood panel. It's going to come back and look like she's leukemic, he said. And she's probably not but it will show, elevated levels because she's had this fever for so long, he said, and it's going to make you nervous. And my husband said, do it anyway. And let's either prove me wrong or prove you right. And then have the conversation from there. And he did it. Right. He did it. So it was, yeah. I feel like some of it, in some instances, you feel like you don't as the consumer. And this is where I love working in an environment with nurses because they can help you. A number of times I've said to Tasha, like, this is going on at home. What are where would you go? Like, what kind of doctor do I need? Or what would you ask for when you've got somebody like that in your life? I feel like you feel a little bit stronger about the kinds of questions you can ask. It's hard to be an advocate for yourself if you feel like you don't know what to ask.
Right. Yeah, you're absolutely right. Oftentimes, like I said, I talk to a lot of members during the day, and a lot of them, and I deal a lot with members that have diabetes. And there's a lot of people out there that don't like to go to the doctors, but diabetes, it's, when you have a chronic disease, you can't sweep it under the carpet and think it's going to go away. It's not. And, the more you can be educated about your chronic disease and be in control and be your own advocate, is the more that you can kind of pull those reins in and be in control of your own disease state. Bring those blood sugar levels back down to normal, help to decrease your risk of chronic diseases like heart attacks and strokes, and the list goes on, and ultimately death in diabetes if it's not controlled. If you can accept, and a lot of it's probably denial, you get that diagnosis of a chronic disease state, it's scary.
Yeah.
And you don't know who to go to or who to ask. And, that's what we're here for. Call us, ask us questions, ask your doctor, ask your care team. That's what we're all here for. And if you get an answer that you're like, I don't understand that, can you explain it? Have them explain it. We as healthcare providers, sometimes we talk and it's like, we think that, the normal person understands what we're talking about, but you might not. So,
Right.
Ask us it's sometimes a reminder to us also. Bring it down to my level. Tell me exactly what it is. And, very often I use an analogy of a car, to the body. Like, you got to put gas in it, right? You got to put gas in your car. You got to check your oil, check the air in your tires. It's the same way with your body. Check your blood sugars. Make sure you're getting your blood work done. See your doctor frequently. Get your eyes checked. It's just like taking care of your car. If you don't take care of those things, the car is not going to run.
Except that my knowledge of car parts is about as good as my knowledge of body parts, other than the ones that are immediately visible.
Sorry. I have to circle back to the Dixie McCall reference earlier.
Oh, yeah.
So I did not know who that was, and I Googled her. And, Julie London, right?
Yep.
So what do you often, when you're on the phone with members or just humans in general, do you often think, what would Dixie McCall do? Like, talk to us about that mind-blowing moment when you're like, I want to be her when I get older.
Well, I went to nursing school a long time ago, and she always looked so like crisp and clean. She had on her little white uniform and her hat. And when I went to nursing school and I graduated, I actually just saw my nursing picture recently, and I'm like, I kind of look like it. I got my little hat with my blue stripe, and I had my white uniform on, and I'm like, yeah, I just want to be like her. And I always wanted to be a nurse. And, I had a conversation with my mother, and I'm like, was there ever a time I wanted to be something else? And she said, never. You have always talked about being a nurse, and that was my dream. And I went for it, and now here I am, a nurse, and I've held a lot of different positions, and there's so much out there that you can do as a nurse. And I'm the only nurse on my side of the family, so I do get a lot of phone calls from family members, and sometimes my answer has to be, did you call your doctor? Like, I'm not a doctor. I can't diagnose, but did you call your doctor? And, they're like, no, not yet. I'm like, well, after you hang up with me, you need to call. I could give you the questions to ask and a little bit more insight because, I guess when you have that conversation and, just like you said, Sarah, you've talked to Tasha or you've asked other nurses questions. It's now your healthcare provider or your healthcare team here is asking additional questions. And now when you call your doctor, you're going to have those answers because they're probably going to ask you the same things. Like, how long have you had it? What does it look like? Do you have a fever? You know, so you're already starting to think and get that education and knowledge to be able to give a great example to your physician of what's really going on. You know, and it makes it so much helpful. The more information you can give to your provider, it makes it easier for them to make a diagnosis.
So let me ask you a question, because I think, you know, my youngest sister was born with a heart condition. And I think I spent my entire life watching my parents advocate for her. If you were talking to a member on the phone, what, as far as being an advocate for themselves, what's the one piece of advice you would give them? How do you become an advocate for yourself on something where you feel like you don't understand it?
You need to ask questions. You know, when I first started in medicine, it was the doctor and the patient. It was always the doctor and the patient. And now you have a care team. You might have a physician, maybe a nurse practitioner, a PA, a dietitian, a nurse. You know, you have all these people on your care team now. You know, go to reputable sites like the diabetes.org site if you have diabetes. Read up on your diagnosis. Be familiar with what is different about you that you're not liking. So know your body, know the symptoms, and be able to reach out to your physician and have that conversation and not be afraid to pick up the phone. You know, a lot of things can be prevented. And the more we kind of tuck things under the rug and not say anything, you know, sometimes bad things happen. So if something's not going right, it's you, it's your body. Take that responsibility and just ask the question. They could always call their insurance company, you know, and speak to the case managers. I'm sure all insurance companies have case managers. Can always ask questions. Ask the doctor, ask the nurses.
That's really
good.
There's
support
advice.
Groups out there also.
Mm-hmm. That's a good point, that even people with experience with a similar condition or diagnosis can probably provide a lot of guidance.
Right. Yeah.
So good. Well, Anita, thank you so much for joining us. This podcast is brought to you by Nova Healthcare Administrators. And why did they let us do this? Because at the end of the day, every Nova associate is driven to do what's right. We want what's best for our clients and their members, and we do a great job sharing what we learn with each other. Between our colleagues and business partners, we know a lot of kind, smart, and thoughtful people who we convinced to share their tips with you.
Don't forget to leave a review, give us a like or subscribe, but more importantly, share. We'll find the insiders, you share it with the outsiders. You can find our podcast on Apple Podcasts, Spotify, and pretty much wherever you find podcasts these days.